Strep A is a common bacteria that is sometimes found in the throat or on the skin. It usually causes mild illness like sore throats and skin infections. In rare cases, these bacteria can cause a severe and life-threatening illness called invasive group A streptococcal disease. Strep A is spread by close contact. It can be passed on through coughs and sneezes or from a wound. Some people may have the bacteria in their body without feeling unwell or showing any signs of infections. If you have no symptoms, you can still pass it on, but the risk of spread is much greater when a person is unwell. Strep A can cause infections in your skin, soft tissue such as muscles, tendons and ligaments, and your respiratory system. Possible infections include tonsillitis, pharyngitis, scarlet fever, impetigo, and cellulitis. Symptoms include sore throat, high temperature of 38 degrees Celsius or higher, chills, and muscle aches. Most people with a high temperature or sore throat have another virus and not Strep A. It is rare that you will get a serious infection. For example, a mild illness like tonsillitis stops being contagious around 24 hours after you take antibiotics. You can usually treat your child's symptoms at home. Ask your pharmacist for advice on medicines. You can usually give your child liquid paracetamol, for example Calpol or ibuprofen. This should help improve their symptoms. Follow the dosage instructions on the bottle or packet. Trust your instincts. Bring your child to your GP if you are worried about your child. Contact your GP urgently if your baby or child is feeding or eating much less than normal, has a dry nappy for 12 hours or more, or shows other signs of dehydration, is under 3 months and has a temperature of 38 degrees Celsius, is older than 3 months and has a temperature of 39 degrees Celsius or higher, feels hotter than usual when you touch their back or chest or feels sweaty, is very tired or irritable. Call 999 or 112 or go to your local emergency department if your child is having difficulty breathing. You may notice grunting noises or their tummy sucking under their ribs. There are pauses when your child breathes. Your child's skin, tongue or lips are blue. Your child is floppy and will not wake or stay awake. Invasive group A strep is the most serious infection linked to Strep A. You can get invasive group A strep if you have sores or open wounds, damage in your respiratory system after a viral illness, or a health condition that reduces your immunity to infection. You are also at greater risk to invasive group A strep if you have a weakened immune system. Infections caused by invasive group A strep can destroy muscles, fat and skin tissue, can lead to sepsis, can cause organ failure, for example in the kidneys, liver or lungs, can cause a fast drop in blood pressure. These infections are very rare. They are not common, but there has been a small increase in cases this year, particularly in children under 10. You are at higher risk if you have been in contact with someone who has invasive group A strep, if you are over the age of 65, if you are diabetic, if you have heart disease or cancer, if you recently had chickenpox, if you have HIV, or if you use steroids or other intravenous drugs. Symptoms of invasive group A strep can include a high temperature of 38 degrees Celsius or higher, severe muscle aches, or redness at the site of a wound.